February is Heart Month, and we're all familiar with exercise and diet to help the heart. But have you thought about your toothbrush or stem cells helping your heart?
Yesterday, we told you about how stem cells are helping repair damaged hearts. Dr. Dianne McCallister, reporter at Adventist Hospital's Chief Medical Officer, here every Wednesday, as always. So let's talk about some of this. Remind us what stem cells are exactly and what they do.
Stem cells are cells in the body that have not differentiated into an organ like a heart or a lung. And when they divide, their daughter cells can form any organ in the body. So they're what we call pluripotential. They can become anything.
They have that potential. So that's pretty exciting. Does that mean that one day we might not ever see heart disease again?
Well, that's a stretch from where this study started. This is really about done at Cedars-Sinai. The study is looking at people who've already had a heart attack and who had scar tissue, over 24% of the ventricle that pumps blood into their body. And they took these 25 patients and injected their heart with these stem cells that can become anything. And what they found is these patients, a large proportion of them had heart muscle regenerate in the area where the scar was, compared to patients who just had the standard treatment where all they had was scar tissue at the end of the study.
Wow. So you talk a lot about prevention when you come here every Wednesday. We talk about different topics. How can brushing your teeth be a preventative measure for heart issues?
Well, you just don't think of your dentist as your heart's best friend, but there's really good evidence linking gum disease with heart disease and stroke. And so the thought behind it is that the gums are leak your bacteria from your mouth into your bloodstream every time you get your teeth cleaned, but people with gum disease, it's probably leaking all the time, and it's thought that there's some kind of inflammation or response to the bacteria that causes the plaque in the heart vessels.
So another reason to floss,
to floss,
not just brush. I mean, do what Mom has been telling us all these years.
Yes.
Are there other diseases that are associated with these gum issues?
Yeah, interestingly, diabetes, stroke, heart disease, and even preterm births have been linked to people with gum disease. And the scary fact is the CDC estimates about 80% of Americans have some sort of gingivitis or gum disease.
Wow.
Yeah.
Okay, so this is important. All right, we're going to start flossing then, right?
I know, you need.
Thank you, Dr. McCallister. She's here every Wednesday, as we've said, and if there's a topic you would like to see her discuss, email us at 11 a.m. at thedenverchannel.com. You can also find all the past interviews, the past topics. If you go on our website, thedenverchannel.com, and click on Staying Healthy, you'll see all kinds of good information.